Welcome to our clinical sites virtual tour. Let's start our tour with Harborview Medical Center. Harborview is our big level 1 trauma center that takes care of patients in 4 states. We are the only level 1 trauma center for Washington, Idaho, Montana, and Alaska, and admit over 6,000 trauma patients per year. We are the 3rd busiest trauma center in the country. It also serves as our mission hospital, serving the county population of Seattle. And Harborview is fairly famous in Seattle and very well respected. There's a general attitude that if you ever need help, even if you are uninsured, an immigrant seeking asylum, homeless, addicted to drugs, anything like that, Harborview will take care of you without question. Let's take a little closer look at Harborview. Here we have the ambulance bay, and as you can see, our EMS system still uses backboards, which give a little colorful grading as you walk into work. Now, this is filmed when it's still dark outside in the morning, but down the ambulance drive, you can actually see the water, hence the Harborview name. Let's walk in through the ambulance bay, and we walk in. On our right, we have the trauma bays. On the left, we have the medicine side. Now, Harborview is different in that it is separated physically into trauma and medical sides, although there is certainly overlap in the patients. However, we do organize our staffing and our teams to cover trauma patients and medical patients at different times. Here's back triage. As you can see, our nurses are busy at work. They're an amazing team here, and it is a sought-after position for nurses to work at Harborview because it is kind of a crazy place where you see super sick and complicated trauma patients in addition to the county population. Here we're walking by our fishbowl, and you can see one of our medical students, Beth, trying to get out of the way of the camera. She's awesome because she works with us at our sim center, which is great. Here we have some morning teaching in the fishbowl. At Harborview, we have morning teaching daily at 7 o'clock for every resident available in the emergency department. And this is done either by a 4th-year emergency medicine resident or by one of the attendings. And the rest of the attendings in the department will cover your patients so we can focus on teaching. And we cover a broad range of emergency department topics and often get hands-on. And right across from the fishbowl, we have the radiology suite just 2 steps away, which is wonderful to be able to accompany your patient to CT and to be able to talk to the radiologist. Next, let's take a look at the radio rooms. So when you are a senior at Harborview, you will rotate through holding the pagers and serve as the EMS command for the city of Seattle. So you get a sense of the pulse of the city and what's going on. Any code, any sick patient, the medics will call you for advice, and you can direct them to the correct hospital and help them give the correct treatment. They're really awesome, and they usually don't need too much help, but we often have some good input for them. Here is the radio room on the trauma side, which actually serves as disaster control should there be any large disaster incident in the Seattle area, such as an earthquake or chemical exposure. Next, let's walk over and take a visit to our social workers, who are arguably the most important people in the department. They are staffed 24/7, 2, usually 3 social workers at any time, and can assist with housing resources, addiction resources, food, clothes, or just emotional support. All right, let's return to the trauma side and take a look at our resus space. So as you can see, we have fairly new construction resus space with all the bells and whistles, ultrasounds. We have 2 workstations in addition to mobile workstations. We also have these awesome screens overhead where you can display radiology results if you'd like. And our monitors are really nice because they angle and swivel 2 ways, and you can remove one of them to make your patient really easily mobile to CT. Another cool feature of the remodel is that our ultrasound findings can actually be projected on the giant overhead monitor, which is really useful during trauma codes or teaching, so that the entire team is able to see the ultrasound findings. We can also hook up our glide scope to this so that everybody can watch you as you intubate. So let's go over and take a look at resus 2. And on our left, we actually have radiology. You can see the sign for CT3. Here's Resus 2, and this is where the fun happens. This is where the thoracotomies and crazy traumas and resuscitations happen. You can see our blood setup is already there. We have a thoracotomy and a chest tube tray, all wrapped up for COVID. Similar to other hospitals, traumas are tiered by various criteria like vital signs or mechanism. We use full or modified criteria. For full traumas, we get the full range of specialists to the emergency department, including anesthesia, general surgery, the blood cart, the ABG carts, and respiratory therapy. Because these patients have a very high likelihood of needing to go to the operating room, it is actually very helpful to have everybody come down to the emergency department at once. And it is not infrequent that a patient only spends 5 to 10 minutes in the ER before they get whisked away to the operating room. That being said, our consultants, while they are amazing, are not doing the primary stabilization. That is all on our ER folks. So we own the airways, and anesthesia is there for assistance should we need it. General surgery is present and helps with the resuscitation. However, we still do procedures, chest tubes, central lines, all of that. So we don't divide by day or by side of the body. It's generally who is trained and available to do so. And we have a very collegial relationship with our general surgeons. So we get plenty of chest tubes. Based on the NEAR study that looked at intubations at residencies, we are among the top performers for numbers of intubations in all residencies, and I can tell you that all of our residents graduate with at least 2 or 3 times the amounts of chest tubes that they need. We all feel very comfortable because there's just so much trauma. Like I said, we are the 3rd busiest trauma center in the United States. Now, let's take a walk down our trauma hallway past Resus 2. As you can see, Resus 3 is under construction, but looks identical to Resus 2. And just beyond Resus 3, we additionally have the angio suite, where we can do interventional cardiology procedures or neurointerventional procedures. So it is fantastic to have everything so close. We have blood in the emergency department, including whole blood, packed red blood cells, FFP, and platelets ready to go, in addition to the blood cart that comes up for full traumas. One nice thing about our system as well is that the local EMS department and airlift also carries blood, which is really helpful and makes all the difference for those very sick, hypotensive trauma patients. Let's move on to the medicine side. This is right around the corner, and you can see the morning team working in the doc box. We have curtained rooms here because this is an older emergency department, but during COVID have been spacing out the patients every other room. And as you can see, the red tape kind of clears the red zone or the sick zone. The curtains can be nice in that you can just push them back if you need more space for a sick resuscitation. We do have private rooms, though, our isolation rooms, and those are great for coronavirus patients or TB patients who need negative pressure. We also have a couple rooms that have a dedicated shower, and those are really nice to have when you have a sexual assault patient who needs a little bit more privacy and may want to take a shower after having their sensitive exams. Also in the ambulance bay, we have a decon room for chemical exposures or more commonly body lice or scabies decontamination. As you walk out of the ISA room, you go to the other side of the medical side of the emergency department, the green side of the ER. It's a little quiet at this time of the morning, but throughout the day we'll get more busy and be full of patients and nursing staff. But here you can get a look at one of our other workspaces where physicians and nurses can get their charting done and get through the day. Similar to UW, from 1 to 11 p.m., we have a pharmacist on at all times, in addition to the pharmacist that will come if there's a sick patient. And the green rooms are very similar to the blue rooms, just slightly smaller as they are for less high acuity patients. You can also see radiology. We have an x-ray suite right next to ED Green, which is fantastic. Now let's move over to ED East. So this is an area that used to be kind of an observation unit. However, we have taken back over in order to keep our patients safe during coronavirus. So we space our patients out every other room. So we've taken over this spot and refabbed everything to have all of the equipment that we had in the other emergency department rooms. And as you can see, we've added plexiglass. So this is actually one of my favorite areas of the emergency department because the stock rooms still have a lot of the fun inpatient things like sleep masks and headphones, and the better snacks. And it's the only area in the emergency department that also has windows. As you can see, the sun is starting to come up as they're filming this. We still have the curtained rooms, as you can see. And we have a dedicated nursing station over here so they can have direct eyes on any sick patients which may be nearby. All right, so that is our tour of the Harborview Emergency Department. The only thing we didn't get to show you was the Psychiatric Emergency Services, which is right next door, which is a dedicated 12-bed seclusion area for acutely psychiatrically ill patients. We often do medical clearance and send them over to the PES so they can get psychiatric care, which is an invaluable resource as our county population needs a significant amount of psychiatric care. As you can also see, walking back to triage, there is this hallway to the left of the emergency sign, and this is called the Garden View hallway. This is kind of a flex area. As you can see, we have a lot of storage there currently, but oftentimes we will do morning teaching there instead of in the fishbowl, especially if we need a little bit more space. It is also a flex patient care area if there's a disaster or if we're having any boarding issues or for any reason we need extra space to see patients. We have some portable kind of curtains, and we can see fast track patients in this space. So it's a pretty adaptable environment. One last stop at Harborview, let's take a look at the resident room. So Dr. Stern was actually supposed to take this space. It's a nice corner office up on the 3rd floor, and it's still dark during this filming, but if you look out during the day, you have beautiful views of Rainier. So Dr. Stern actually gave this up for the residents to use and took kind of a dingy office downstairs, which was very kind of her. And as you can see, we have lots of workspaces. Again, all of them have Dragon, just like in the emergency department, which is a dictation software. You've got some nap couches, you've got a fridge, we have some video games and a TV, and we also frequently have snacks. And then something cool is we also have a balcony. If you're brave, you can also climb up to the 10th floor and get a little bit better views of downtown, or you have great views from the 3rd floor. You can see some of our stadiums and a couple buildings in South downtown Seattle, which is really wonderful. And now we will move on to University of Washington Medical Center at Montlake, just a couple miles up the road from Harborview. So UW is our quaternary care hospital. We rotate here to take care of specialized patients in transplant, cancer, cardiology, and other extremely sick and medically complex patients. We rotate both in the emergency department, of course, and also in the ICU, both as interns and as third years. UW also serves as the community hospital for the University District and the 35,000 students who attend school there. It's a pretty cool location located on the shores of Lake Washington and across the street from the Husky football stadium, just outside the Link Light Rail station. It has been routinely selected as the #1 hospital in Washington State by Consumer Reports. Okay, so let's go in and take a look around. Here's the waiting room. As you can see, there's a little office over in the corner where security is present 24/7. This is very early morning, so they are chatting with our registration folks. Behind the waiting room, we have the triage area. So as an intern, you will do a dedicated month here to get used to the system, as UW is a little bit different from our other clinical site, Harborview. The schedule incorporates a 2nd and 3rd year EM resident as the backbone, staffed 24/7, and then interns kind of fill in the gaps, both emergency medicine interns and also off-service interns such as anesthesia, psychiatry, internal medicine, you name it. This is a great opportunity to take care of super sick patients, as UW has one of the highest admission rates in the country. I believe they call it the Sick Index. So let's take a look at the specific spaces in the emergency department. Let's start with room 1. So this is a room we are especially proud of. This is our dedicated procedure room for ENT, dental, ophthalmologic, and any head and neck procedures that need to be performed in the emergency department. As you can see, it's equipped with a special chair, a bunch of extra special equipment like the slit lamp, and all these supplies. We thankfully also have 24/7 dental residents who can come and do procedures in this room at any time, and they often use it as a backup for their clinic should they need to do an emergent procedure. And this is kind of a shared agreement so that we can call them at 3 in the morning to help with odontogenic abscesses. It's really helpful to have. Now, across the hall from room 1, we have rooms 8, 9, and 10, which are special because they have direct access to triage, and they're kind of more rapid turnover room. Our triage nurse can also take care of them quite quickly without having to use a dedicated nurse. All right, let's move on to room 2. This is an example of one of the resus rooms at this department, which as you can see is much larger and has a bunch more equipment to take care of critically ill patients. Here we have our airway setup, ventilator, we have a Hoyer lift, we have a bunch of extra supplies, workstations, everything you could possibly think of. So these are great, and like I said, you see a lot of very critically ill and complex patients here. A lot of transplants, cancer patients, LVADs. People routinely come in and have very few of their own organs and a long med list that you have to look up because the medication is brand new. We also are a stroke and STEMI center at University of Washington, so you will frequently take care of both of those types of patients as well. As with any emergency department, we have well-stocked supply rooms, but the most important part is that we have awesome MAs like Emil here, who's restocking. And they are available 24/7 and are a fantastic resource in the department to help you set up for procedures, get patients anything they need, and keep the department flowing. And here's just a view of many of the different supplies we have here. A lot of them are dedicated to LVADs and pacemakers and all sorts of unique things that only the UW populations have. We also have a dedicated orthopedic room with splints, crutches, splinting material, and orthopedics is available 24/7 here. However, we generally do all of our own reductions and splints here unless we need help, as they are covering another hospital at this time. Then we take a walk down the hallway, and as you can see, we have multiple ultrasound machines, and this is just a few of the ultrasounds. We also have our central line kits just right across the hall from our resuscitation rooms. There are 5 of those. Then a little bit farther down the hall, we have some dedicated rooms for psychiatric patients. They are seclusion rooms dedicated to patients who are at a danger to themselves or others. So we have these garage doors that come down and cover all the dangerous equipment, and they are monitored by camera, which you can shut down if you have a normal patient. And then we have a dedicated staff member observing them at all times to make sure that they are safe. Just around the corner from the seclusion rooms, you can exit the emergency department, and while radiology isn't quite as close as it is at Harborview, it is still right across the hall. Then if you look over to the left, we have a dedicated resident room with computer workstations, Dragon, storage, anything you could need. And the door beyond that is locker rooms with scrubs, bathrooms, showers, a lactation room. Let's return to the emergency department and get a quick look at the physician work area. So this is the fishbowl, and as you can see, it's an early morning shift, so we have multiple providers working right now. That's the back of Ian Mallett, who is working as a pretending as his R4 shift. So this is our general workspace we call the fishbowl, and the doors beyond it go into a staff bathroom and a break room, which is very close, and then there are patient rooms just outside. We have changed everything, as you can see, due to COVID times. We have masks for everyone, and we've shut down several workstations so you can sit farther apart. What's also nice about these workspaces is that they're very close to social work. So we have 24/7 social work here, usually 2, but always at least 1. And they are our mental health providers for the emergency department and help us make decisions about referring to the psychiatrists for detaining patients to the state. We also have a dedicated teaching area at UW, which is also a flex workspace, but the door closes and we can do some hands-on ultrasound or procedure training. We also obviously have a whiteboard or just space to work and dictate. Every workstation has Dragon dictation as well, and we also have video and phone interpreters at University of Washington, which makes it convenient as we have multiple patients who speak many different languages. Right around the corner from the fishbowl is our pharmacist work area. Now this is a very early morning time, so the pharmacists aren't in yet, but they are present in the emergency department from 1 to 11, and they also come down for any codes or very sick patients that need a pharmacist present. They are super helpful as many of our patients have very complex medication lists, and they can often be helpful to choose antibiotics or talk about side effects of some of these rare chemotherapy agents. Right next to pharmacy, we have our registration folks and a work area for nursing. Before COVID, this area was also where we did morning briefs, but we don't want to gather too much staff together at the same time, so we no longer do that. Hopefully that will get reinstated soon. Next, let's walk down the other main hallway. This is kind of a square in the department. These are the regular rooms in the emergency department. University of Washington is very nice because we have multiple private rooms, including many negative PPE rooms. We also have hallway beds, although at this point in the pandemic, we are not using the hallway beds unless there is a severe emergency, just to protect our patients. Here's an additional nursing workstation, which is not being used because our volumes are low this early in the morning. Our higher level rooms, 26 and 27, are suites that are negative pressure rooms, safe for coronavirus patients needing aerosolizing procedures, and they also have their own bathrooms so the patients don't have to walk around the department. So here's just a view of the nursing work area and some more storage. But I'll take the opportunity here to say that UW is a fantastic place to work and take care of some really critically ill patients, and it takes a lot of teamwork to handle all of these complex patients. The nurses here are so comfortable with LVADs, it's scary, and you will learn a ton from them. So this is a really great place to work and challenge yourself to get exposed to new and potentially uncomfortable patient situations.